Rahim. Assalamu alaikum. It is exactly 12:36, and that, of course, means we're into our final interview for today, right here on the Mid Morning Show. We will be talking with Dr. Raadhiya Osman. She's a clinical research pharmacist, and we are going to try and understand oxygen therapy with Dr. Raadhiya Osman. Dr. Raadhiya, assalamu alaikum. Welcome to the program. Lovely to have you here with us. And I've about oxygen therapy on and off over the past while, but I don't quite understand what it's all about. So you're here to give us the lowdown on it. Lovely to have you here. Welcome.
Thank you so much for having me. This is a great opportunity. I'm looking forward to this conversation. So basically, just to give our listeners a little bit of feedback or understanding. When we talk about oxygen chamber, we're referring to hyperbaric oxygen therapy. So essentially, in just to understand it, you enter into a specially designed chamber where you breathe in oxygen in an environment with increased atmospheric pressure. And the simplest way to understand it or to explain it is oxygen is one of the body's most important healing resources. So under increased pressure, more oxygen can dissolve into the liquid part of the blood, allowing oxygen to reach tissues where circulation or healing may be compromised. This increased oxygen availability also can support the body's natural healing processes, including tissue repair, wound healing, and the formation of new blood vessels. And important for this, for our listeners, is that this is not a miracle treatment, or it's not a replacement for conventional medical care, but in the right person, for the right indication, it can be really a valuable supportive therapy.
So, Dr. Raadhiya, who can benefit most from oxygen therapy? And currently, what is it most commonly used for?
So there's two sides of this conversation. Firstly, there's well-established medical uses for the hyperbaric oxygen therapy. These include conditions such as your decompression sickness, carbon monoxide poisoning, certain difficult-to-heal wounds, for example, in your diabetic patients, as well as radiation-related tissue injury and some severe infections. So there's a growing interest around recovery, inflammation, fatigue, brain health, and healthy aging. Research in these areas are developing, but the evidence is not strong over every claim. So I think it's important to distinguish between established medical indications and emerging wellness applications. The person who benefits the most is the person who has been properly assessed, who has clear, realistic understanding for undergoing the therapy.
So we've heard many claims, in fact, about oxygen therapy boosting energy and vitality, something you touched on as well.
Yes.
What benefits are supported by this, and is there evidence to actually support that it's the therapy that is boosting the vitality and the energy levels?
So yes, this is where we separate science from marketing. So there's strong evidence for hyperbaric therapy in specific medical conditions, particularly where tissues are oxygen deprived, damaged, or struggling to heal. So there's evidence in its role in wound healing, like we said, radiation tissue injury, decompression sickness, and certain other medical condition. When it comes to increased energy, sports recovery, anti-aging, or general vitality, the science is interesting and it's evolving. But obviously, we don't want to overstate it because, like we said, research is ongoing. Many of our patients report feeling fresh, energized. And there's studies where there's reduced inflammation, recovery, and healthy aging. But science is ongoing and the research is ongoing around that area. So the responsible message would be that the oxygen is biologically powerful, and it has its benefits each patient as an individual according to their condition and treatment protocol.
You are a clinical research pharmacist. Are you involved in research of this treatment modality?
So not particularly for this modality. However, we are in contact with the relevant clinics that are doing this research, yes. But personally, I'm not involved in that currently at the moment. However, we are moving towards that.
So are there any risks or side effects or misconceptions that people ought to be aware of before they embark on this type of therapy? It sounds absolutely magical, I might add, but we've got to be realistic as well. You keep referring also to cell repair, and I'm kind of thinking cancers, is there evidence that this has been successful in cancer treatment? But I should imagine it would be in conjunction with other treatment that you are receiving. It might be chemotherapy or radiation. And let's understand how this works for cancer patients. But before you do respond to that, may I please ask you to just hang 10? We're going to take an ad break and we'll continue right after.
That's absolutely fine. Thank you.
Discover the Africa of your dreams and surround yourself with her spectacular beauty. Relax beneath her serene sunsets and explore wildlife at its natural best. It's where the pride of Africa comes together. The Kwantu Private Game Reserve. Get to know the Big Five or cruise on an elephant safari game drive. Interact with lion and tiger cubs and enjoy world-class halal cuisine while we pamper you during your 5-star stay. Indulge in the true African experience. For reservations, call now on 042-203-1400 or visit kwantu.co.za. The Kwantu Private Game Reserve, the place of gathering.
Gaza needs your support more than ever. Homes have been shattered and families have lost everything. With your support, our teams are delivering clean water tankers, feeding the hungry, and assisting orphans who have no one left. Let us give Gaza whatever help we can. African Muslims Agency, empowering, educating, inspiring.
World-class financial services only at Sapphire Global, your financial partner. If you are looking for Islamic, Sharia, and ethical financial products, look no further. Sapphire Global offers a wide range of financial service offerings from short-term to life and investments. A full-service center with all financial requirements under one brand. Our highly skilled and experienced consultants are ready to help protect your financial future. Contact us on 041 001 0184 or visit our website on www.sapphireglobalfs.com. Sapphire Global is an authorized financial services provider.
Right now, in some of the most devastated parts of our world, places close to many of our hearts, Doctors Without Borders is delivering emergency medical care where no one else will. Your donation gives a child surgery, a family clean water, a community a fighting chance against disease. This is an opportunity to make your giving count where it's needed most. Visit msf.org.za/sadaqah, that's SADAQAH, and donate today. Doctors Without Borders, we go there.
Rejuvenating media day by day. This is Salam Media.
It is exactly 12:46. We are talking with Dr. Raadhiya Osman. She's a clinical research pharmacist and she's here to help us understand oxygen therapy. Raadhiya, welcome back. Would you like to respond to the questions I've put to you before the break?
Yes, No problem. Thank you, Julie. So I think that's an important part of the conversation when it comes to side effects. The most common misconception that people would have is that oxygen is natural and obviously completely risk-free. However, we do see that the oxygen is the hyperbaric oxygen. The side effects are very minimal. But there are some side effects which are like your pressure in your sinuses and in your ears. It's sort of like when you are in an aeroplane and when you take off and when you land, the pressure that you feel in your ears is what you experience when you're in the oxygen chamber. When it comes to the oncology or the cancer component of it, so yes, it is complementary therapy. What happens is that because of radiation, tissues get damaged because radiation at the moment is not specifically targeted. So as a result, tissue gets damaged, and what oxygen does is that it helps with the tissue healing, with healing of the tissue in cancer patients as well. Yeah.
So talk to us, sketch a picture for us of what the tank looks like. Do you kind of step into it, crawl into it? How big is it? And for how long do you have to remain in the tank? I'm kind of thinking I'm one of those people who feel pretty claustrophobic, in confined spaces. So, would I do well in a situation like that?
So when you look at the thing from the outside, it actually doesn't look as big as it is on the inside. It's a sort of a lazy boy concept where you go inside and you relax. It's big. You can take your laptop in with you, your phone in with you. So it's a very relaxed sort of an environment. I personally sit in there with my little boy for his brain injury. So I sit in there with him in the oxygen chamber. So parents can sit in there with their kids as well. We have parents with children that are autistic that sit in the chamber as well with their kiddies. So it's a big chamber. However, if you are claustrophobic, our team is there with you. So we're sitting next to the chamber. There's a little window there. So we always checking up on you. If you feel at any point that you want to get out, we decrease the pressure. We bring you out. It's not you step into the chamber, so you don't crawl into the chamber. You step into the chamber, but it's a very relaxed environment. I must say, it's sort of my time away from the world where we just sleep and rejuvenate. And when you come out, you just step out feeling so much better. With regards to the treatment times, that's variable. So according to patients' needs, certain patients, depending on that's why a pre-assessment is so important. Depending on what their needs are specifically, whether it's tissue injury, whether it's mental health, and how bad is it. Well, many of our patients come in for skin health, to rejuvenate the skin as well. So it has anti-aging benefits as well. Like I said, the science behind it is evolving, and there's more science as we obviously go on and the research goes on. But yeah, it's variable according to patients and their needs.
So
but generally,
sorry, I didn't hear that. I'm kind of wondering, we talk about, you mentioned mental health. You also spoke about anti-aging. It's very rejuvenating for the skin. And you also made mention, you shared something personal about your little boy. And I think if I heard you correctly, something to do with a brain injury. So
correct, yes.
If you look at the three different treatment, I should imagine it would be different treatment options for each different condition. What are we looking at here? If we're looking anti-aging, how many sessions would the person need? How long will they be in the chamber? Is it something that they'd have to do on an ongoing basis? Question number one. Question number two, how does it assist a mental health patient? what specific mental health ailment would one be a candidate for to get this, the oxygen therapy for? How would it help? And then also, you spoke about your little one. If you don't mind, I know it's a personal question, but if you don't mind sharing, I will respect it if you don't want to share. However, are you seeing any changes, and what specific condition has he presented with that you are, you've gone this route in his treatment?
Thank you for that, Julie. So when it comes to the anti-aging benefits of it, like I said, it's very patient specific. So we would have to look at patient's skin, chronic conditions, and now the buzzword in science is inflammaging. So inflammation causes aging, and as a result, we see it on the skin, we see it in the body, the way patients feel. So we could use the oxygen chamber brings down inflammation. Like I said, it goes down to certain parts of the body where there's inflammation, brings down the inflammation. So on the skin as well, you would see those benefits. Like I said, it's patient specific. So I'm just giving you on like a typical patient, and on an average for anti-aging, they would need sort of a once a week session, or even once every 2 weeks, and then obviously after that monthly. So it's normally generally around 1 hour sessions for those type of patients. When it comes to the mental health component, with that, there's certain conditions like your autistic patients, patients with brain health conditions, brain injury conditions, Alzheimer's, Parkinson's, because oxygen is life. The way I explain it to my patients is that, when a tree grows outside, the roots, they need water and oxygen to grow. So in the same sort of concept or analogy, the neurons and the cells in our body needs oxygen to thrive. So that's how in easy terms, how I put it. When it comes to my son, that's why I think this type of therapy is so dear and close to my heart, and I'm so passionate about it, is because of my little boy, who suffered left brain injury in a motor vehicle accident, and as a result, he has dystonia. So the right side of his body is in dystonia. So as a result, we are now I've started using oxygen therapy. So this was how the whole concept of it started. O2 IV Wellness started, was because of my little boy. So I've definitely seen benefits. That's why I am all for the oxygen chamber, because I think when you see the results with your own eyes in your child, it just means so much more. So he has, when he sits in the chamber, he's automatically able to use the right side of his body, because like I said, the oxygen goes, it turns into a liquid form where the blood can use it, and it goes to certain parts of the bodies that needs it. So even to the brain, the part of the injury where in the part of the brain where it is, the oxygen goes there. And it heals. So for his sort of situation, he needs therapy twice a week, where he sits in the chamber twice a week, and I sit with him. So it's our time together, and yeah, he's very happy. He looks forward to actually sitting in the chamber. So yeah, I've definitely seen results with
So
him.
that's about an hour at a time, twice a
An hour.
week.
Yes.
That's why you look so good, mashallah, because you get
With the oxygen.
you're getting all of that. Yes, it's working great on you. Let's talk about the process. So I approach you or the clinic, and I say I have these health conditions, and I am I am being treated by my medical practitioner. However, I feel after having spoken with you that if I undergo oxygen therapy, it will speed up the health issues that I'm dealing with. So you'll take a full history, and then
Yes.
together, will you consult with my health practitioner as well and jointly decide how much of the therapy I need, and at what point would you decide or I decide that I think it's working or it's not working, and I think I want to now stop taking the therapy?
Yeah, so thank you for that. I think, yes, definitely. Initially, we do a proper full assessment, understand what the patient actually wants to achieve from the therapy, and we need to set realistic goals because this is a very natural treatment. Many people, I think people are very, especially people that have, very sort of their medical conditions are now persistent over a long period of time, and they now sort of in a hurry to get better. But this is a very natural sort of healing process, so it's important for people to understand that, and to set realistic goals. And yes, when it comes to certain conditions, especially certain chronic conditions, we would consult your medical practitioner as well, and understand how we can optimize your therapy. I think that's really, really important because we work as a team. It's important to work with your medical practitioner, like I said, and then we optimize your therapy in that sense. When it comes to anti-aging, wellness, yes, those type of things, we can guide you on that.
Okay, so what about bone fractures? Would oxygen therapy assist with the healing of bone fractures? Yes, so you go to your orthopedic surgeon, you have the bone reset and whatever else happens there, but wanting to speed up the fracture, the healing of the fracture, and also to get back full use of that limb.
Yeah, so absolutely, because so post-op, we have many patients post-op. So we have the orthopedic surgeons sending their patients to us post-op for the recovery. So it helps with the healing. It definitely speeds up the healing. And we've seen this in practice and also in science, in clinical research. It has been shown that it does speed up healing.
So, Dr. Osman, let's look at the issue around if I come for the therapy for whatever reason, whatever my condition is, I won't have to ingest anything at all. There's no pills or anything to be ingested. It's just going into the chamber. And I should imagine you've got some do's and don'ts as well, pre the session and post the session. Having said that, does medical aid cover these sessions?
So yes, when you go into the chamber, there's no pearls that are needed. It's basically sitting into the chamber, and like how you would use a nebulizing mask, we have a mask that you put on where the oxygen, where you then inhale the pure oxygen. When it comes to the do's and the don'ts, there's not actually many do's and don'ts. It's basically the most important thing is not carrying anything sharp into the oxygen chamber, but you're welcome to carry, like I said, your cell phone, your laptop, carry on working. Many people just like to switch off and just relax, because obviously when you relax, your body recovers better. With medical aid, unfortunately, right now we are still punting for that, but unfortunately medical aid does not cover these as yet. So we're hoping that we will see. Because wellness and healthcare, patients are becoming more aware of it. So we are also hoping that medical aids will jump on board with us.
Absolutely. I think we've come actually to the end of the interview, but is there anything of importance you'd like to share with us? That's number one. And also, how do people get in touch with you, people that have been watching this interview and feel that this is an option they'd like to explore? How do they get in touch with you? And is there anything else of importance you'd like to share with our listeners and viewers this morning?
Yeah, so I'd like to let everyone know that hyperbaric oxygen therapy is an exciting and evolving field. The key approach is both with curiosity and scientific responsibility. So it's not about claiming that the oxygen can cure everything. It's about understanding how increased oxygen delivery may support the body in the right person for the right reason and under the right supervision. I think that's really important for me, for everyone to understand that. With regards to getting in touch, perhaps I can provide you our details. We are on Instagram, O2IV Wellness, and I will provide my contact details with the team at Salam Media. And yeah, they can WhatsApp us and we can set up appointments. You come in for your assessment. We're happy to do online assessments as well for patients that live, a little bit far away from where we are. And yes, we're happy to accommodate everyone.
Okay, great. You will provide all the contact details. We'll put it up on our website. And just as a matter of interest, are you based in Johannesburg?
So we have moved to Raadhiya, Walkerville side, which is a little bit further away from where we were. We were based in Houghton. However, we've just moved away 3 weeks ago. So we have a new address.
Okay, great stuff. And that's a beautiful part of Johannesburg. It's kind of almost, you drive out there and you feel you're deep into the country. You can't believe you 10 minutes out of the city. Raadhiya Osman, Dr. Raadhiya Osman, it's been wonderful talking with you. Good luck. And I have no doubt lots and lots of people are going to reach out. I suppose, to look better, to feel better, and to heal quicker, inshallah. Thank you so much. Go well, and salaam alaikum. You. And that's it from me at 3 minutes after 1 o'clock. Thank you for being with me on the mid-morning show. I'm off now for the rest of the week. Inshallah, I will rejoin you on Monday morning on News and Views. In the meantime, you keep safe, keep warm, and take care on the roads. As always, Assalamu alaikum and Khud Hafiz from me, Julie Ali.